we all are familiar with, or we're focused on those patients with the worst eye disease, the most intractable cases for sure. But I think it's important to recognize that the overwhelming, and I want to repeat, the overwhelming number of patients are in fact um, ones that will improve spontaneously, and many of them will improve completely. So that when we talk about this disease, we sort of have to begin to understand as best as possible some factors that can predict the bad outcomes, right? So if we can pick those people out, we'll know who better to treat. In my first consultation with a patient, my objective is to determine, obviously, if they have the right diagnosis and the severity of their disease. I mentioned it earlier that trying to get an understanding of the severity of the disease um, tells me how and how much to intervene on their cases. So the mild cases may come in mild, but they may have those dispositions that make them likely to ultimately become severe. So just as an example, those are older patients. They tend to be male smokers. We think that people with obstructive sleep apnea are also in that group. Diabetics, people with high TSIs. And what is also important is how quickly they are getting worse. So patients who come to me at 6 months into the disease with just a little bit of eyelid retraction are far less likely to progress, require far less attention as an intervention than the patient that shows up to me at month one and they already have a significant amount of lid edema and their muscles are stiff and they may have early double vision. These are folks that I need to separate. So again, while a person might be mild when they first show up, I need to predict as best I can who's going to get bad, intervene early, suppress their disease. We just published something recently to resort how we begin to consider the therapeutic armamentarium, but we need to decide when to employ measures that suppress their disease, preventing it from progressing, and when to employ those drugs that might suspend the disease early. And that makes it a very complicated process, but it's an important one for people in this field to begin to think about a little bit more carefully when we consider our patients.